Thank you. Well, welcome everybody. My name is Erica Haller-Stevenson. I am an administrator for the Violence Prevention section at the San Antonio Metropolitan Health District. If you're not familiar with that agency, we are the local health authority for the San Antonio and Bexar County area. We are a department of the City of San Antonio government, but we also provide public health services and policy for the area inside of Bexar County. Today, I'm going to be telling you more about a new initiative, the San Antonio Bexar County Violence Prevention Strategic Plan. So I'm going to go through the purpose of the plan today, the framework for building it, how it's constructed, how the plan has been developed to date, because it's not quite finished yet, and give you a sneak preview of a draft of it and the portion that's related to domestic violence. First, I want to give just a little bit of background because a lot of people ask me, working with the health department, why is the health department working on violence? Well, that's because violence is a public health issue. Ultimately, if a person isn't safe, then they cannot manage other health and wellness issues. For example, if someone has asthma or diabetes, or they even struggle to get to the doctor because of insurance issues or transportation issues, none of those things really matter if you're not safe in your home or in your neighborhood. And that is based on something many of you are familiar with, Maslow's hierarchy of needs, where we need to take care of our base needs first before we can take care of more complex issues. So the health department is focusing on this as an effort to prevent violence so that we can improve safety, and ultimately will reduce injury and death if we can do those things. I wanted to share some kind of context for our community and what things look like in Texas as a whole versus Bexar County. So you see a table on your screen with 5 columns. Columns 2 and 3, if you're counting from the left, have the years 2020 in it. So that's comparing the county and the state for 2020. And then the 2 columns on the far right are comparing the county and the state for 2021. So I just want to show you how to navigate that. What we have here in parentheses inside each field of the table are the number of crimes against people, homicide, sex offenses, or assault, if they're in the parentheses. And then the larger numbers above the parentheses are the rates. So rates are a method of using some math to account for population size and make things comparable to each other. So while the state of Texas has approximately 30 million people living in it, we can make some comparisons between Bexar County and Texas by converting these numbers of crimes into rates. For example, in 2020, Texas had a homicide rate of 6.2 per 100,000 people, whereas Bexar County had 7.7. Now, Texas is averaged out across the entire community, so that incorporates the really dense urban areas like Houston and Dallas with the very rural areas that have much lower rates of homicide. So this just tells you where Bexar County sits relative to the state as a whole. You'll see that we had an increase in 2021 for Bexar County. If we're looking at sex offenses, we do have a fairly stable rate of those between 2020 and 2021, but Texas as a whole had a significant jump in 2021. And then moving on to assaults, you'll see we have a higher rate than Texas as a whole for both years, but that rate is fairly stable from year to year. These are just some examples, and they're actually, you need to have a lot more discussion and review of data over multiple years to look for patterns and look at the causes for those things. But I want to give you a sense of the kinds of information we're looking at relative to this strategic plan. So this plan is focused on violence against people and how we prevent that. So part of the process to setting this up was looking at homicides and sex offenses and assault. Additionally, family violence comes into play. And I wanted to give you some more particular statistics for our community around family violence. So the Collaborative Commission on Domestic Violence puts out a statistical report each year, and I pulled together data from the last few years from their reports. And on the left side of your screen, you'll find a chart that reports the number of homicides related to family violence, and it compares the City of San Antonio jurisdiction in the maroon color to the Bexar County jurisdiction in the lighter blue. On the right side, you have the number of family violence reports filed, again comparing the City of San Antonio in maroon to Bexar County in the blue. Naturally, the county will have fewer homicides and fewer reports filed because the population is smaller than inside the city jurisdiction. But you can watch the comparisons from year to year between the two entities, the two jurisdictions, and among themselves. And more importantly, we should add these together. And that's why I actually graphed it that way for you. So you can look at the total when we add City of San Antonio and Bexar County together. How many homicides were there related to family violence? How many reports were filed related to family violence? Because we all know that issues with public health and issues with family violence do not stop at an invisible line that you draw between different government jurisdictions. People move back and forth, travel back and forth for different reasons. So we need to look at the community as a whole. So you'll see that we had a peak in homicides in family violence in 2020, and that is something that has received a large amount of media coverage and also a lot of attention from the Collaborative Commission on Domestic Violence and stakeholders in the community. Since that time, we're beginning to see a decline, and we should actually see a report in the next month or so on the 2022 data. If you look at the reports filed, you'll see an increase in reports filed. And I specifically wanted to share this because I want to caution folks about how you compare issues like declining homicides with increasing reports filed. So just because you have an increase in reports filed or an increase in calls to 911, that does not mean that there is an actual increase in family violence. There is a possibility that that increase is because people are becoming more comfortable with interacting with law enforcement, with reporting their issues, with calling 911, and there can be a whole host of factors combined. But it's important to understand where we have been and where we are now as we develop strategic plans. We want to look at where we sit and where we want to go in the future. So many of you might be familiar with the idea that there was a domestic violence plan developed by the City of San Antonio and released in 2019. And it has been part of the guiding force for the Collaborative Commission on Domestic Violence, who has taken the lead to implementing many portions of that strategic plan, as well as many of the city departments. It was branded as the Love Is City of San Antonio Comprehensive Domestic Violence Plan. I also wanted to mention some of the other work that we've been seeing in our region that I can account for in terms of what the City of San Antonio is doing. In the fiscal year 2023 for the City of San Antonio, all of the departments collectively and all the work done by the City of San Antonio had a budget of $36.5 million toward affecting domestic violence and the people who are impacted by it. And finally, what you're going to hear a little bit more about as I kind of walk through this particular topic, in 2023, the San Antonio Police Department initiated a new project called a Violent Crime Reduction Plan. And they are specifically working on violent crimes against people and trying to address that from a law enforcement perspective. So we have these three fairly significant initiatives in our community, along with many others being completed by other organizations as well as Bexar County, but we don't have a cohesive regional strategy. And that's what made me interested in embarking on developing the strategic plan you're going to learn more about today. So I was looking for a way to bring these different pieces together and really harness what different organizations are doing so that we can work together. So the purpose of this strategic plan is to develop a strategic direction for San Antonio and Bexar County as a community related to violence prevention and intervention. It will include a 5-year roadmap that addresses priorities related to violence and the causes of violence. And this 5-year roadmap will begin in January of 2024 and end in December of 2028. It will identify shared priorities and evidence-based strategies that will allow all of our organizations, our businesses, our stakeholders to work together to create a greater impact on domestic violence. It will help us create partnerships to collaborate on our efforts, and it can attract funding for the programs and services that you deliver. By having a cohesive strategic direction in your community that other organizations support, that often is attractive to funding providers and is something that you can utilize. So next, I'll talk about the framework or the basis for this strategic plan. So there's going to be a lot of public health talk in here, but if you have a social work background, this is going to be familiar to you too, and we can answer questions about this. So really the intent here is to take our community from focusing on their individual priorities among organizations and governments to shared priorities through shared goals and directions. So right now we have many organizations working on family violence and intimate partner violence, but we all have sort of slightly different directions and different purposes. In the end, we all want the same thing. So what we really need to do is help define how we get there together. None of us have the resources we need to accomplish this by ourselves. So we need to find a way to share our resources and expand our impact. This strategic plan will focus on the prevention continuum. So we won't be looking just at services after somebody has been impacted by domestic violence in some way, but we're really going to be looking at upstream and downstream solutions. So if that is terminology you might have heard, the idea is that an upstream solution is something that occurs in the primary prevention phase before violence has ever occurred. So you've heard already in the sessions today that supporting children through their development, modeling safe and healthy relationships and teaching them about those safe and healthy relationships can help them avoid domestic violence to begin with. That is a form of primary prevention. On the downstream end, this is when you are working after violence has occurred and you are trying to help mitigate and reduce the effect of that experience. And that experience could be for the person who was victimized or for the perpetrator. Many of you are also familiar with social determinants of health. This is a concept where different things in the world around you have an impact on your health. It's not just about your personal choices. And this is something that everybody is learning more about and is very important to incorporate in any strategy that is developed to impact an issue as with the magnitude of domestic violence. So I'm just going to quickly walk through the 5 domains of the social determinants of health and give you some little examples just to increase your familiarity with that. So we all know that if somebody does not have access to healthcare and the sufficient range of healthcare that they need, that they're likely to die sooner than the people who do have that. So that is a social determinant of health. Your neighborhood and the way the physical environment is structured around you is another determinant of health. If you don't live in a safe neighborhood and if it is not built in a way to support your health and well-being, it has a negative impact on you. We also know that things like racism, practices like redlining are all versions of social and community determinants of health, the way our policies and our society affect a person's health and well-being. We can easily see in our own lives that your economic stability has an impact on your health. Not only does it influence your ability to receive health care, to buy prescriptions, it also influences your mental health. So the ability to earn the money that you need to sustain yourself and your household are a social determinant of health. And finally, education and access to the quality education are important. If you are not able to complete high school because of circumstances in your environment and in your world, you will earn less money than other people. If you earn less money than other people, it's harder for you to get health care. So it's a chain reaction of different determinants of health, and they intersect in several areas. So I wanted to lay this out because these social determinants of health are addressed in the strategic plan. We want to focus on root causes and how things impact our world, not just on the end result of that. So pushing these two ideas together, if we look at the prevention continuum and things that are upstream and downstream interventions, and we combine that with the social determinants of health, we can find ways to reduce inequities between people who are impacted by domestic violence. Obviously, a large portion of our community is impacted by domestic violence in some way. It doesn't have to mean that you are the person who has been abused. It may mean you have witnessed the abuse. It may mean you are a perpetrator of the abuse. But there are factors in your world that may make you more or less likely to experience that. And that's called health equity. So this strategic plan focuses on combining these issues of upstream intervention and downstream intervention with social determinants of health. So we can attack these issues more in the area of the roots rather than the outcome at the end. People who have experienced violence always need support, but we also need to do work before that happens to reduce those negative outcomes for people. So next, I'm going to talk about how this strategic plan is being developed. And I mentioned it's still in development, but it's very, very close to being done. We're probably about a month away, and you'll get a sneak preview at the end here. So I am working with a team of other people. We are going on a journey together through a multidisciplinary national leadership academy focused on public health. So my team and I come from different organizations and have different backgrounds. We have a representative from San Antonio Police Department, somebody from the faith community of St. John Baptist Church inside San Antonio, and a researcher from the University of Texas at San Antonio. The four of us are responsible for coordinating this process. However, this process is collaborative, and it is being developed and populated by stakeholders throughout our community. And we have really been making our best effort to try to bring in stakeholders across the board as much as possible, rather than us making these decisions and sitting down and writing this strategic plan. Our job is to make sure to get all the people to the table and coordinate the process for them. We began at the beginning of this year by getting community input together. We held town halls. We attended several public events and community meetings where people talked about what mattered to them in terms of violence. And we asked them, what bothers you? What are you worried about? And what do you think we should do about it? We also reviewed data similar to what I showed you at the beginning of the presentation that tells us statistically where we stand in our community with different issues around violence. We used that community input and community data to select 4 priority areas for the strategic plan. The reason we did that is because you can't accomplish everything at once. And our intent here is to bring people together in a common direction for a common goal. So we need to make sure that we narrow this down enough that we can really focus our resources and have a big impact together. So from March to August, we selected those priority areas. We recruited participants for work groups based on each priority area. And those work groups included people from local government, from the healthcare sector, from community service organizations, those who are providing direct services to community members, the faith community, making sure that we brought in faith leaders. We brought in advocates and activists, as well as researchers. So our goal was to bring together a fair representation of different sectors of the community so we could get different perspectives on this. As we worked together, these different groups each focused on a single priority area and developed a draft plan for that priority area. Since that time, we've been circulating these to different organizations and stakeholders asking for comments. And that occurred through the end of September. So now that we're in the first week of October, we are reviewing all of those comments and making adjustments to the strategic plan. We're then going to be assembling all of the parts together, making sure that we have clear objectives, strategies that are evidence-based and capable of being implemented. And we're including measurement indicators. So we have a way of seeing what our progress looks like over time. This strategic plan will be published in November prior to Thanksgiving, and we'll be excited to share that with all of you. The city and the health department are kind of taking the lead on pushing that out to the community, but this is a roadmap that is really going to be available to all of us. Again, with the goal that we work together to accomplish something greater. And the city of San Antonio is going to utilize the roadmap. I, being the administrator for the violence prevention section at Metro Health, I'm going to use this roadmap to help determine what my team works on. And this is a way that you can use it too in your organization. If you are preparing a grant proposal, you can use the strategic plan to identify where we need to do some work in our community and where there is some support and some traction for that kind of thing to be done. So the community input process, I mentioned, I just want to give a little bit more detail on it, included some engagement with community organizations where we spoke to community organizations themselves and to the people who use the organizations. We conducted some town halls and joined others, and they were often organized by leaders in the faith community, and they hosted them as really kind of a community gathering space. We also spoke to people who work in the field, those who are the workforce of community-based organizations, those who work in the city of San Antonio, in Bexar County, and University Health System as some really large employers that have a stake in impacting violence in our community. We pulled all of this information together from the community, from the statistical data, and from the workforce to select the priority areas. I mentioned that there were 4, and these are the 4. And a little bit later, I'll focus more on domestic violence. The first one is violence among youth. This is focused on youth violence, ultimately, primarily in school settings and after school settings. It includes strategies that focus on issues like bullying and cyberbullying, as well as preventing violence among youth. And ultimately, we're trying to create a strategy for making spaces safe and supportive for youth. We want to make sure that they are in a world that is comfortable to them and provides them what they need so that they are not attacked and so that they don't feel a need to do the same. Gun violence is another priority area. This one focuses on preventing violence, gun violence involving youth and adults. So it's not limited to adults, but it does include youth. And it focuses on services and supports for victims and survivors. It addresses mass shootings in schools and addresses repeated violence by perpetrators, trying to prevent recidivism. We also focused on sexual violence, looking at preventing sexual violence against youth and adults, providing services and supports for victims and survivors, and again, reducing repeated violence by perpetrators. And finally, domestic violence is included with a focus on intimate partner violence and abuse of children. This includes services and supports for victims and survivors again, and yet again focuses on reducing repeat violence by perpetrators. So these are the 4 pillars ultimately of the strategic plan, and a work group was formed under each of these 4 areas. So once the work groups were formed, we had 46 different entities represented. As I mentioned earlier, it includes community organizations, advocates, people with lived experience, both as a victim and as a perpetrator of violence, people from local government, people in the healthcare sector, faith leaders, and researchers. So we just completed the community feedback section. I mentioned we're using that feedback to adjust and fine-tune the strategic plan. As a reminder, it will be released in November, and then the clock starts in January in terms of implementation of this strategic plan. So next, here comes the sneak preview. So I mentioned that this has not been released to the public yet, but it is circulating as people are giving their feedback. And I want to walk through with you what some of the main categories of strategies are in the domestic violence section of the strategic plan. What I did was organize the work group's notes into kind of large buckets, and I'm going to share those buckets with you and explain what they mean. We'll have 4 slides here that we're going to go through. The first one really focuses on data gathering and assessing the community. So the work group focused on domestic violence said that we need to do more work in assessing the community's current resources and needs. We need to improve the type of data that we can obtain, how we share it, making sure we share it, and then how we utilize it. We also should be creating public-facing data dashboards about the impact of domestic violence in our community and the impact of interventions to reduce that. The work group recommended identifying risk and protective factors that are very specific to our community. We all know that there are fairly typical risk and protective factors that apply to most people, but you can have nuances in your community, and we want to make sure that we research that. Additionally, they recommended researching, identifying, and implementing interventions that focus on the root causes of the issues and invoke primary prevention in that strategy. In the next collection of major strategies, these focus on things that go directly to people in the community. So the group recommended implementing an ongoing comprehensive communication campaign that would include harnessing social media, using social media for a positive result, considering it can have such a negative result in many cases. So putting that message out there about resources that are available and changing the social norm around domestic violence and child abuse and saying, it's not okay, it's never okay, and these are more appropriate behaviors and actions. That's what the group recommended. They also recommended building a formal system to refer people across organizations and services. Often what we have to do now is give people a list of resources and phone numbers, or maybe we help them make some phone calls. But an ideal situation would be to have a better way to refer people that we work with to other organizations in a more direct way and ensuring that information gets from one entity to the other. We also want to recommend implementing culturally relevant and effective methods to support immigrants who are experiencing domestic violence and child abuse. And we want to increase services and programs for people who commit domestic violence and child abuse. In the next slide, we're talking about things that are driven through partnership and how you have to work with partners to make these things happen. The group recommended identifying and implementing ways to incorporate education on healthy relationships in schools. The group wants to increase partnerships with the business community and really bring them into the effort to address domestic violence and child abuse. And the group wants to deliver training and technical assistance for community serving organizations and large employers. So that it's a recommendation that if your organization is an expert in these things, you can help provide this technical assistance on topics like trauma-informed practice, compassion fatigue, and other things that make employers and other community serving organizations more prepared to support people who experience violence. And in the final slide, these are really entrenched policy issues. And the recommendations from the work group were to expand access to mental health services for people affected by domestic violence, including intimate partner violence and child abuse, increasing our investments as a community in affordable transitional housing, and creating more protective environments by building on our existing infrastructure and addressing the gaps around them. So that is the end of the presentation. I'm going to take myself out of that kind of presenter mode so I can see things. We see that Noah in the chat already added information for continuing education, but we have some time now that we can use to answer questions, and I can try to give you more specific information. Okay, we'll hold for just a minute in case anybody is struggling to get a question in. I want to make sure we don't cut anybody off. No, I don't know if you maybe want to start closing announcements just in case. And people actually could get sort of an extended break. And if you didn't get lunch, you would have an opportunity to do that. But you will find my email address here on the screen. You are welcome to continue to put anything into the chat that you want to ask. And I'll let Noah manage anything that he needs to do.
Sure thing. Well, thank you so much, Erica, for your presentation today. If anyone has any last-minute questions that they want to drop in the chat, that would be fine as well. But if not, please take a moment to take care of yourself. Get up, stretch, get something in your belly, get some caffeine if you need it, or some water or something. And our next session is due to start at 3:45. Again, so 3:45, go ahead and make your way to the next session. We have our public health track, our advocacy and awareness track, and our legal system track. So please feel free to choose from the menu, and we'll see you soon.
Thank you. I do see some questions that I'll answer. And these are familiar names. Jane is asking if any businesses are already interested in partnering. There is some interest just in the planning process where people have identified organizations and businesses where they say, I know that this organization is interested in this and I want to address this with them. That part of the next phase after this plan is about ready to be released is really going out, myself and all of our partners, and bringing people together to the table to say, here are opportunities where we can work together. We know that there's an interest in this and what needs to be done here. Let's do this together. There's a question from Lupe Lopez about whether there's been a consideration for putting another shelter in the city of San Antonio. That was not specifically identified. However, all of the components that link to that idea were identified in the strategic plan. There is a call for more services directly for the community. There is a call for transitional housing in particular, and that was an overwhelming issue that came out in the conversations with community members at the beginning of the process and in the strategic planning process. There is a high demand for an opportunity for transitional housing so people have places to go as they build their ability to live independently of someone else, or if they have to give up everything that they have. So there are some things are a little bit more narrow and specific in the strategic plan, and other things are a little bit more broad intentionally, so that people can identify what fits in their mission. So you don't have to go far off track of what you do, and you can still help contribute to this effort. And ultimately, the goal is that together we're going to accomplish a lot more by focusing on certain areas at the same time.
Thank you so much for your questions, Jane and Lupe. Oh, you have another question.
Jane's got the magic question. Are there funds available to provide more services in transitional housing? There's no specific funding that I have heard of or have heard other people mention. What we're doing part of the strategic plan is telling all of us together what should we work on together. It's also a call to action for our government and community leaders saying, these are the things that we need to do and we need you to fund them. We need you to pay attention to them. We need you to invest in them. So that's an opportunity that we're taking on through the strategic plan, is not just what are we going to do together, but where should we make policy changes? What should our legislators vote for in locally and at the state capitol? Where should we be putting money as we're making plans for growth of our community, or you're making organizational strategic plans, or a business is making major donations, working through its philanthropy, or we saw a lot of news coverage on the recent city government budget. These are all opportunities to guide people who can make those investments in transitional housing. Well, all right, I'm excited everybody actually can get a good break too. I know many people did not get an opportunity to have a real lunch or a real opportunity to get up and walk around. So please do that. We've got a little bit more time together today, and we want to make sure that you can get through that and still learn something. And again, you're welcome to grab my email address in the slide, possibly the longest email address in the city of San Antonio. And you can use that to email me and ask me any questions, or look at what's happening after January and how we can work together. Thank you very much.
I went ahead and put Erica's email in the chat as well.
Great idea. Easier to copy and paste.
Yeah, so folks can copy and paste. And so thank you so much, Erica, for your presentation today again. And again, folks, take care of yourselves, and we'll see you back at 3:45.
Thank you, everyone.